Good afternoon, ladies and gentlemen. It's my pleasure to welcome you to the IPS-Nathan Lecture Series by Mr. Philip Yeo, our 16th S.R. Nathan Fellow for the Study of Singapore. Today, Mr. Yeo will be delivering his second lecture titled, Transforming Singapore's Economy Through Research and Development. Following his lecture, Mr. Yeo will take questions from the audience in a Q&A session. The Q&A session will be chaired by Dr. Lisa Wee, Assistant Chief Executive at A-Star. Before we begin, please allow me to go over some housekeeping rules for the event. Thank you for joining us at the auditorium today. Please be reminded to switch your mobile phones to silent mode. The lecture is being streamed live on Facebook. It will also be recorded and uploaded onto our IPS website and our social media platforms later. Please submit your comments and questions at any time during the lecture through the Facebook comments. For our audience members here at the auditorium today, please step up to the mic during the Q&A session to ask your questions. We would also like to hear your views on the event. There will be a link in the feed and QR code on the screen at the end of the lecture to submit your feedback. Ladies and gentlemen, without further ado, I would like to invite Mr. Philip Yeo to begin his second lecture titled, Transforming Singapore's Economy Through Research and Development. Mr. Yeo, please.
Well, this is a formal title, so I just go to the next more important page. Now, this is a very important page for two reasons. First and foremost, when Dr. Goh became Minister of Education in 1979, he was very interested in science and research. So he got his good friend, Baron Victor Rothschild, who was then Chief Scientific Advisor to Margaret Thatcher. So Baron Rothschild came to Singapore, and Dr. Goh invited me for a free dinner. And then one thing said, okay, we're going to do some research. What can we do? So Victor Rothschild helped Dr. Goh to find a scientist called Sidney Brenner. Sidney Brenner was still then director of the Lab for Molecular Biology at Cambridge University. And he brought Sidney Brenner to see Dr. Goh. And he came to ideas, how can we build up a science, medical rights research? At that time, the most popular subject was interferon. So there was a Singaporean who was doing research in Alberta University. So Sidney Brenner brought him to Singapore. And this is this appointment where Dr. Goh got Sidney Brenner to visit PM Lee Kuan Yew. And exactly says, look, why you want to do biomedical science? After all, we are a nation of technicians. And Sidney Brenner was exactly here. If you prefer to be a nation of technicians, then that's it. So this statement I kept it for a simple reason. Sidney Brenner has been the father of molecular and cell biology. And this year is the 40th anniversary of IMCB. You can see his pictures there. Actually, most people are not aware the whole of science, biomedical, actually started by Dr. Goh. So he got Sidney Brenner to come down. And then we even had David Baltimore. I first met David Baltimore after I helped to fund IMCB. At the age of 37, he received the Nobel Prize for tumor virus. He was then, after that, became president of Caltech. So he came with his wife, Alice Wang, who used to be the Dean of Science in New York University, to be the Scientific Advisory Board. So these are the key people. So you got Sidney Brenner, Dr. Goh, David Baltimore, Alice Wang, plus Reese Lim, and Chris Tan was a Singaporean who was in Alberta, who came to Singapore and built up IMCB. Now, IMCB is an interesting story because Dr. Goh wanted IMCB to set up in 1984. Where to get the money? Conveniently for him, September 1985, although I was Chief Public Secretary Defense, a member of the board of BDB, I was made chairman of Skill Development Fund. As you know, Skill Development Fund is a racket. Every company who employs anybody less than $1,000 had to pay a 2% levy, almost a tax. So as chairman of Skill Development Fund, I had a $600 million petty cash. So Dr. Goh invited me to MAS chairman, deputy chairman MAS, Philip, can I get $40 million from you? Here's the deputy chairman MAS trying to get $40 million from me. I said, okay, what can I do? I give you $40 million, 2-year loan, provided NUS, Prof. Lim Pin, Vice Chancellor, will pay me back. So IMCB was Dr. Goh's idea. Sidney Brenner was a founder, and I was a banker for 2 years. So today, this year, exactly 40 years of IMCB. I can see from here, what is most interesting today is, after 40 years now, originally we started all the scientists was all abroad. Today, I have our own scientists are there, And our own executive director is our own scholar, Su In. She took over only April this year, right? No, April this year. So it's a complete, so I'm very satisfied that IMCB took us 40 years, but today we have our own Singaporean running the show. Now, how did Singapore come to research? When I was in defense, I was also chairman of Defense Science Organization. I chaired the EXCO, developing weapons, whatever, every month. When I came to EDB, all I saw was manufacturing. I said, we cannot just be production. So I grumbled and finally I told Minister of Trade Industry that we need to do something about research and development, and this is how it formed. So I called him in Tokyo, in Nagiku restaurant downstairs, and said, look, we have a breakfast. We need to do something about research. So that's how the situation. When he asked me who's going to be the chairman of this research organization, he suggest, I said, well, my colleague Lam Chuan Liang, with the public sector industry, is very free, so I made him chairman. Now, here we are today. So the key is in 1991, we gave a $2 billion budget to NSTB, and then it went up to $4 billion. But in 1999, 2000, I was very concerned that although I managed to bring pharma companies to Singapore, it was just pure production. And as far as Singapore, there was really no, other than IMCB, there was no other research institute. So after about February 2001, I took over NSTB, and immediately I changed. My budget was $5 billion, which I inherited from the past chairman. I gave $1 billion back to George Yeo, and I focused on $4 billion. With the $4 billion, I built Biopolis, Fusion Police. I put a budget of $1 billion to fund all the scholars. How they manage it, I'll explain to this. I squeeze here and there. So the key is, so my job was to get the biomedical science off the ground. I got it going until 2007, and then I stepped down. The rest is history. What happens after 2007 is not my responsibility. Anyway, so I play an important role in 2001, 2005, and 2007 to get the things going. And the key was to get the biomedical sciences, I need to go and capture senior scientists. So Senior Brian and I sat down together, 2001, and said, look, let's drop at least 100 scientists that we can borrow, part-time or full-time. Part-time to chair my scientific advisory board, full-time if they can come here. So over that list, then two of us went on visiting universities, even see David Baltimore, my good friend Josh Rada in MRC UK, David Lane in London. So we managed to bring all these people. And these are people I call the whales because they came here, they took charge of all the research institutes, which had no additional budget cost to the government. My budget was still the same, $4 billion. We have managed. By 2006, I think things are going. Then the focus is, the basic infrastructure is there, how to move to translation of clinical. So that was a key phase. Then 2011 onwards, my successor continued. But what's important was in 2006, I drew up this plan. It's very important for us to not just do basic science, basic research, but how to bring benefits to patients, which is called the clinical side. So I drew up this plan, and I remember I took all my scientists, plus even Yang Yingyi with MTI, let's sit down together in Bintang. I said, look, this is what we should be doing. We should have a group of yellow group called translational that can take from the research to the clinic. And this is where, at that time, there was no NRF, so what should we do to help the hospitals? So under A-STAR, I was managed to provide funding too. So this diagram needs to be updated, but it's key that we must always think of science is not a means to end. The end is patient. And obviously, to the patient, you need drugs, devices, so you need the industry. So it's got basic science, you need the clinic, the bench side, plus all the industry. Now, I want to build a place where I can put all the scientists together because in NUS, there's IMCB by itself, part of NUS. So I decided to take IMCB out, put under A-STAR, or I changed the name from NCB to A-STAR. The key is how do I build a new facility to house all of them. Obviously, I cannot go to the government and ask for budget. It will take me years to get my budget. So I came up with ideas, look, we'll get JTC to build for me, and I pay rent. So I don't own the building, and JTC said, I'm not building it for myself. So the whole of Biopolis phase 1, which is 2 million square feet, was built in 18 months with no approval from the government of Singapore. And today, that's it we have. So today, Biopolis has about 4 million square feet. The buildings are a bit difficult because they're very, architecturally looks very good, but space-wise not so good. But this is where we are today. And A-Star has progressed. Biomedical sciences, which is my main topic, I don't cover engineering, well established. Now there are 9 institutes. Obviously, they are all on different specialties. Hopefully, they'll continue to grow. I hope is that every one institute will be run by a Singaporean. Now, the key value to us is that we have also proposed about manufacturing, because at the end of the day, it's not just research, how to get companies to do development, how to get companies to do the drugs or devices. So we have 2 areas in the biomedical. One is drugs, the other is devices. Devices are easier because it's more engineering and it's less rigorous to get approval, and easier to manufacture. But drug development is harder. So most of the drug companies in Singapore are all multinational. There's no local company as of today. Hopefully we have some, but nevertheless, we are one of the top major manufacturers of drugs. America, Switzerland, Ireland has a lot of drug companies in Singapore. So Singapore has done well. Compared to any of our neighbors here, none of them have pharma companies that we have. But the devices is an interesting one because we still continue how to move engineering people to all devices. When you go to a hospital, you see a patient on a bed. All around the patient is equipment, and that's where devices are. Obviously, drugs are from companies, but see, there are 2 key parts, equipment plus drugs. Now, what's the key components or key factors to growth of a biomedical industry? First, intellectual capital. You need to have the brains, intellectual IPOs, patents. And second is the industrial capital to build a facility. Last but not least, in fact, the most important will be human capital. I'll cover this. So if we do this research in a lab, the key is not just research, how to bring it to a product for patients. And this is where the value is created. The value is created not by research, by having a product or a drug made for the patient. So this is the biggest challenge. It takes time because drug development is a long process. You can do a research of a new drug or new potential treatment in 3, 4, 5 years. But bringing a drug to the patient, 10 years, sometimes even longer. And it's because you have to do clinical trial. And clinical trial is human. You have phase 1, phase 2, phase 3. Now there are more and more challenges. But the key difficulty is the market size. And that's where one of the problems of Singapore is market size. Now we continue to invest in NUS NTU has done well. When I first started A-Star in 2001, there are no PhD program at NUS NTU. It's in biomedical science. So every student who graduated from a life science was a bachelor degree. I made a nasty statement, with a bachelor degree, you got a wash test tube. Everybody upset because you do research, you need to do a PhD. It's not just a basic degree. Eventually, they all learned I was right because I'm not a very politically astute person. Yeah? Now, when I look at this diagram, it's interesting. During COVID, the second diagram, Hong Kong is very interesting. Hong Kong share manufacturing GDP is 1%. Singapore manufacturing share GDP is 90%, 20%. When I was chairman, it was 25%. But Hong Kong hospitals, the doctors are very keen to publish. So I traced all the papers on COVID. Every now and then, they publish something. So Hong Kong, notwithstanding, wow, medical science, the papers from medical research, basically for New England Journal, not in Science or Nature, are from Hong Kong. So you can see in 2020, blip, after that it came down. So Hong Kong has no manufacturing, has no pharma, but good hospitals. We have got pharma, got industry, and hospital. Hopefully our doctors will publish more. Now, intellectual capital comes from patents that we register, plus patents enforced. As you know, we have gone very well until 2020. Hopefully this is our COVID effect. Hopefully this will improve. But Singapore has accumulated all these patents. There are 463 patents are still in force. Now, the key is for the IP. For us to develop IP, we have to work with other companies. And the key is to work with companies like Chugai. Chugai is a subsidiary of Roche of Switzerland. Japanese company works on cancer drugs. And they are working on possible treatment for dengue. So key for Singapore, as a small nation, we have to collaborate with big pharma. And big pharma only means who can take the drug into production, to distribution, and sales. So the collaboration with industry is very important. So this example, Sanofi is a French company, very well known for drugs. But we also must involve hospitals. So the key hospitals, the national centers are important. So for medical science, we need drug developers, we need research, we need hospitals. The three are very important. Now, it's interesting, I've been watching the drug developments when I first started in 2000. There's a big change. 2001 to now more than 20 years ago. In old days, all the work was done by big pharma. Development, finding drugs, production. But today, more and more of the development are from small companies. But these small companies, their strength is discovery, very focused. If they succeed, they have to license out to big pharma. So big pharma now reduces their R&D size, but they pick and buy small companies. So hopefully Singapore can find a niche in that small area where we can develop a compound, a drug, then we can license out. Because only big pharma can produce in scale, can bear the cost of clinical trial, which is very expensive, and then manufacture in volume and sell. So our hope is that we can take advantage of this trend today where small companies with good ideas can collaborate with big pharma. Now we have tried this. I started Bio 1 in 2000, EDBI. We put a lot of money in it. The key is that one of the success was a company called S-Bio. S-Bio, I licensed 12 drugs from a company called Chiron in San Francisco. Of the 12 drugs, I reduced to 3. Sell the company on cancer drugs. The cost of development from the 12 licensed products into 3 compounds was okay. But the difficulty was bringing the clinical trial. So eventually, we succeeded. But today, it's no longer owned by us. It's owned by a company. A drug is for cancer. It's called Onjo. It's owned by a company in Sweden. The Swedish company is called Swedish Orphan Bioventure. It's orphan drug. So the key challenge for Singapore, we may discover, but we are not able to bring it to the market. At the same time, we need to find a niche for Singapore. So look, for example, we still invest in nucleic acid. This is RNA as in vaccine or DNA. We can work on cell therapy as in cancer, CAR-TG. But the other things to look for companies, for example, these 2 companies are based in Suzhou, Adagene and Abogen. Adagene is working on antibodies. Hopefully they can succeed. Abogen is harder because we work mRNA for COVID, but after that, they have to reposition it. So in China now, there are many small companies also working on ideas of new discovery and looking for big brothers, big pharma to license out. In fact, I've been looking at material last year or so. Many of the multinational companies are now going to China to buy or license the intellectual property from the Chinese companies who are discovery companies and then take it further to the market. The advantage is that China can do clinical trial. The market size and number of patients is there, which is something we cannot compete with. So these are good examples. Both are in Suzhou interesting. Incidentally, when I first started the Suzhou project, I took over project. There was nothing there but beautiful rivers, lakes, and write poetry. But really, Suzhou seems to be active in research. Now, if many of our institutes, we're trying to get them to focus on not just the research, but outcome, which is a drug development. So I think ASA created this EDDC. Here. So EDDC is an effort to consolidate all the experimental work. So the facility is there, people, the reaching is there, to put all the focus. Hopefully, we can use this not just at ASA level, but at national level. So all the scientists, doctors in different parts of Singapore's medical research can help together, and then we can do all the trials. But the key is that we need to focus on the talent. So this is an area where, looking forward, we might be able to succeed. But here we have to work with big pharma again. These are some of the outcomes of EDC. You can see down there, working with antibody drug development. You go into pancreatic cancer and gastric cancer. Pancreatic cancer is the biggest challenge. There's no drug in the market today. Gastric, I think there are some. But the key is that we may translate into a clinic, but we need to license it. There's no way for us as a small country to take it further. Value added to biotech, that's very key. Now, the most important factor of the 3 factors, intellectual, IP, infrastructure, the key is basically people. This was my advertisement in June 2000 when the human genome came out. So the first thing I do is how do I take advantage of human genome? So I have this young model wearing a DNA on the arm and selling sex appeal for science. because that's the only way to attract talent. And fortunately, David Baltimore came to my office, can I have your picture? He brought it back to Caltech on his wall. Next week, he said, can you please send another one? I said, what happened? Someone stole it. So, and then this president of MIT also came, brought a picture. So this picture is well known. She's a Singapore girl, but not a scientist. Now, science is a long-term endeavor. So you have to bring passion and interest to young people. It's not something, so we would like to start as young as maybe in primary 3, 4, or 5, and in secondary school. So by the time they are ready, after the A level, we would like to capture them for PS, PhD, which is a 9-year program. 3 years of PhD, a bachelor, 1 year of internship, 5 years of PhD. So it takes 9 years. Plus, you have some cases where you have to do a postdoc in IT. So it takes 12 years to train a scientist. This is not IT. We draw a diagram, we can make a cartoon, we can do animation. This is not. So training a scientist is a 12-year effort. But most governments have no patience. They want instant result. So when I was questioned why it takes you, where are your results? Well, when I started in 2001, only when the scientists start coming back, young scholars coming back in 2012, 2015, then we are ready. Today, we are 2025, we are ready. Hopefully, they all grow up to become senior guppies, and then, well, right now we have quite a few of them are running our research institutes. Now, the number of talents we have has grown. Without question, we have grown from 4,000 to 36,000. But one of the big challenges is how to get our young scientists to be more entrepreneurial. And one of the challenges is that as scientists, they like to do the passion, which is research, discovery. But how do you bring it to the market? You also need to be able to encourage them to think business-wise. I work closely with UCSD. Since 2007, I serve on the UCSD, University of California, San Diego Advisory Board for Medical Science, 2007 to this day. And what they have is they help to set up a school. They set up a school for business school, ready business school. So all the doctors and scientists will do part-time EMBA for 2 years at the Ready School. So Ready School of Business focus only on MBA, focus on scientists and engineers. So maybe we have to think along this way. BBA is no use. I'd rather have a guy with MBA, as a doctor or scientist. So what they do is that if you're a scientist in San Diego, you do a 2-year part-time effort. Every 2 weeks, you go to university. So at least the scientists learn to be business-oriented, business-exposed. So maybe our NUS, NTU have to think of how to re-educate our scientists. And so I have my own experience that I served on the Ready School of Business for 7, 8 years. I stepped down recently. But I still serve in health sciences. And there, I talk to doctors, scientists. They're very keen to know how they can go into the real world. Because in many of the young scientists today, not many are interested in academic positions. Because academic positions, assistant professor, associate professor, full professor are finite. And some universities, the professor never retires, so there's not much hope. So many young scientists today want to go out into the real world, which is industry. And help in industry, business training is important for them. So our young scientists, today we have trained 1,800 PhDs, all Singaporeans plus new Singaporeans. Of the new Singaporeans, I don't think more than 15%. So all of them are Singaporeans. So I'm quite proud today that all 1,800 of scientists are scattered off Singapore. They are in industry, they are in investment, and also we run our labs today. And this is the greatest pride. If any of my scholars come back, after 2001, 25 years ago, they are now running institutes. So this we can be proud because we are far better than any of our neighbors in this region, all run by Singaporeans, our research institutes. So how can we respond to future trend? There are 2 key developments. One is drug development. It's still a very tedious and long process. So hopefully we can use AI in drug discovery in reducing the number of options and cases they can do. So hopefully we can use it in screening of what potential drugs we can. The other issue is you need to use data. So with AI, the big data is important, clinical data, all kinds of data you want. So these are 2 areas we can use. The AI for biomedicals is now well known. Everybody tries. Because the process of selecting potential drugs, you can focus using AI as a means to select. So a lot of effort is being done this way. Although some people think that this is still expensive because AI itself, hardware-wise, are quite costly. The other one is that in Singapore, in AI drug development, hopefully we can choose the targets. So our A-star people in EDDC can look at ways and means, but we need to combine people expertise here. So now with AI being focused on medicine, for example, at UCSD, I talk to the scientists there whenever I go down there. They try to apply AI as much as possible to not just drug discovery, but also analyze the patient's data information. For example, in X-ray, early detection of tissues, this can be done. Now, one of the things we think is that healthcare, the best way for healthcare is preventive, and better still is proactive. Treating a patient when a patient is sick, phase 2, phase 3 is very difficult. It's a challenging job. Can we go to a society where in the medical science we try to be proactive, preventive? Obviously, one is early detection, screening. The other is also wearables. Interesting wearables are paying important data. As you know, Apple Watch, but there's also another O-ring, Oku-ring, people are using it. So our hope is that we can use this. But in Singapore, we started to look at what we call our population base. How can we find information about patients, given that we are a multiracial society? Each racial group has different medical experiences, so how can you use it? So we started in 2017. 2017 we started. We started with 10,000 Singaporean data, complete data, all of them the human genome sequence. Now we are going to, then we went to phase 2, which ended in last year, actually this year. So this year, going forward, we're working on 10% of population, which means 450,000, 500,000 database of all the patients. From this, hopefully we can apply to our own local, because we are unique. We have 4 different races, 4 different, and to be fair, even the dialects are different, but in the Asian, you got Chinese, Indian, and Malay, plus the others. Hopefully we can use this. So this is not something new. In fact, it has really started long ago in 2000 plus. UK started the same idea, but hopefully they are more homogeneous. For us, it'll be interesting, how can we get a complete genome of 450,000 Singaporeans of different ethnic groups and use it for future proactive and preventive treatment of patients. With that, I close, and hopefully Lisa can keep me occupied.
Thank you, Mr. Yeo. For those watching the lecture on Facebook, please submit your comments and questions through the Facebook comment box. For our audience members here, please step up to the mic to ask your questions. May I now invite Dr. Lisa Wee, Assistant Chief Executive of A-Star, to start the Q&A session.
Hi, good afternoon, everybody.
You can
actually, I have a mic.
I don't need it.
I forgot. Yeah. Hi, good afternoon, everybody. So great to be here, and it's such an honor to be here on stage with Chairman Philip Yeo. I've had a pretty varied career in the public and private sector, but I've always joked that I've never stopped working for the one man, who is actually Mr. Philip Yeo. So from very kindly awarding me the Glaxo Wellcome Scholarship at EDB many years ago, then having the opportunity to travel with him as a young EDB senior officer for 3 weeks. I don't remember, Chairman remembers that trip. And then after that, actually helping broker that introduction to my PhD advisor long ago with Prof. Irv Weissman. And then after that, being a champion, and even though, running the economic strategy for Singapore, that's a really big thing, but never, ever not having time to meet with me and other scholars throughout the ecosystem to really be champions for us. So I just am so thankful for Chairman, and thankful to the IPS for being willing to actually doing this series. I think it's a great way to capture Chairman, and you can't really, someone has asked me, what have I learned from Chairman, what has he said? But it's not really what Chairman says, it's what he does. And you just have to kind of follow him around and see what he does, and then hopefully be able to capture that spirit, that can-do spirit, and really take that forward. So I thought I will just kick off some of the questions for Chairman. I think one of the most arresting image that all of us have in our heads is the lady with the DNA tattoo. right at the beginning, that was actually stolen after being gifted to David Baltimore. So actually, a question I have for Chairman is, even from the first lecture that you did with regard to manufacturing in Singapore, you have said that what Singapore should do is kidnap people. So I wanted to ask Chairman, do you change your strategies for kidnapping people? So when you used to kidnap maybe manufacturing talent to start up a lot of the sites at EDB, or when you're trying to capture whales, so like the David Lanes, Barry is here, he has been a really important personality in the local biomedical scene as well. But did you change your strategy when you started to think about capturing whales?
It's easier to capture corporate companies because I can give them tax incentive, I give them support, they come here and they manufacture work. To capture a scientist, you got to capture a prima donna. Whether it's David Baltimore, Barry Halliwell, George Rada, David Lane. For example, David Lane. I was in London in 1999 with my staff from EDBI, and David Lane just set up a company called Cyclocell, working on compounds for cancer treatment. Because David has expertise in P53. P53 is 50% of the problems of all the gene related to cancer. So David asked for £1 million from me to invest in his company called Cyclocell. I was having a light lunch with him. I said, okay, I put £1 million in you on one condition. He said, what's the condition? Come and be my chairman of IMCB SAB. So I brought him to Singapore to chair the SAB, and he came, enjoyed. So he was a chairman of the Scientific Advisory Board. Scientific Advisory Board is very unique only to research. You may have a research institute, you have a director, you are a scientist. You need a Scientific Advisory Board as 4 or 5 people who are international people. And their job is to measure, check, advise, validate what is the research being done by the institute scientists. So it's always very good to have a Scientific Advisory Board of international scientists whose job is to examine the work of the scientists in the institute. So David Lane came to Singapore for 2 years as a Scientific Advisory Board. After 2 years, I said, why don't I come over full time? So he told me I have a problem because coming as a SAB, I can fly to Singapore a few times. How do I get Dundee University to release me? So I said, well, come to Dundee University, which is in, far away, remote. I had to fly there. I sat down with all the president, vice chancellor of the university, all the scientists at the table. The table was a very gloomy one because there I was trying to tell them I need to borrow David Lane. And then they were, so I said, okay, I'll borrow David Lane for you for 2 years solid. After that, I'll return it back to you. So that pacified the whole administration at the university. But obviously, after 2 years, I now return him back. So the key to capture a whale or scientist is a difficult job. So I remember I went to visit many universities, and one of the key universities is how do I convince them to come to Singapore. First, you've got to give them facilities. So when I met, John Wong was with me, we went to see NCI, National Cancer Center, Cancer Institute. National Cancer Institute at that time was a $9 billion budget. So I walked in, I saw Richard Klossner, director of the NCI. Ed Liu was the deputy director. I sat down with them. John was with me. So after I walked out of the meeting, and I couldn't capture Richard Klossner because he's a key scientist, well known. Ed Liu was a Hong Kong person who went to America. So as I walk out of the meeting, John says, are you going to recruit them? I said, sure. That was June 2001. December 2001, I sent a proposal to Ed Liu. These are the terms. All done. He was very happy. Here, I gave an offer. Come to Singapore. What do I need? I want my own lab. So I have to think of how do I build a lab. So you tell me what you want. That's how I started Biopolis. I had to build a lab for scientists to recruit. And that's and so that's how Biopolis was created, because Ed Liu asked me for a lab. He specified what I wanted. I got DCC to build Biopolis Phase 1, and the Genome Institute was set up. Then after 3 months later, he told me, I come to Singapore, but I have a problem. My son, 16 years old, is not happy to come because his girlfriend, he'll miss his girlfriend. So I bring a son and find him another girlfriend in Singapore. So this is the way how you kidnap talent. You have to do a personalized conning game.
Yeah. So Chair, you have a very multi-pronged approach, not just the person, but the spouse and the family. So another tool I've noticed you have is you're very impressive understanding of science. So if you know Chairman, he always emails you these random articles. Sometimes he gives you a hard copy on yellow colored paper with all these highlights of all the key terms with regard to science. So in addition to labs, in addition to finding their sons' girlfriends in Singapore, you also engage them scientifically. How did you do that? How did you, as an engineer, jump into biology and be able to hold a conversation with David Lane about P53?
Well, when I wanted to recruit David Lane, I dug through all the papers published on P53 by him. So when I met him, he knew I was interested in his area. So therefore, if you want to recruit a scientist, you must take the trouble to know what is his passion, what's his research. It's not like PSC interviewing people. It's a very different business. You need to hunt. It's very important. So when I wanted to add you, I was interested in clinical for cancer drugs. When I want to do imaging, I went to see George Rudder, MRC. George was interested. So George says, if I come to Singapore, I must my own imaging facility. I think I gave approval to George to buy the best 9 Tesla machines, big machines for all the animal facilities they want to. So not only if they have to find out what their interests, but find out what they need. So it's a very different business from just recruiting a person. But the key is that if you recruit that one person, you bring the whole lot with you. So when you recruit a chief senior scientist, he brings his own department, and that's how you do. So you steal one and steal all. You're not just stealing one person. And that's a good example. There was a famous lady scientist who was working in the US, in which university I knew, Mary Claire King. So when Berkeley, UCSF want to recruit her, the whole lab moved. So you steal one chief scientist, the whole lab comes. That's it. So that's how you steal people. You steal as a group. A different business from hiring one by one. So therefore, you must understand. I went to see MIT. I asked this MIT Cancer Center. And there you see all the scientists, each of them have very big labs. So if you steal that scientist, the whole lab closed down. So in a way, almost like stealing a company in Singapore, which I used to do in EDV. I go to a company. I remember I went to Everett Life Sciences. As you know, Everett Life Sciences make heart valves. So I visited Everett Life Sciences with the chairman and CEO. I said, okay, we want you to come to Singapore to produce it here. What do you need? Well, I need to find people who can sew all the small pieces of valve for the heart valve. So I think Everett Sciences is now 20 years in Singapore. So I said the best people are people who are used to sewing. So I had to go look around for Singapore who are used to be in the sewing business. So Everett Life Sciences started with ladies in a factory sewing valves. These are valves made from either from cow, cow valves. But that's how. So you must understand the industry. You must understand the person. You must also prepare to support them, and all the way complete.
Yeah, thank you, Chairman. So maybe at this point, I just wanted to say a few housekeeping rules. So we'll be taking questions both online and in person. And in person, please come up to the microphones. There are 4 microphones in this room. So when you come up to the microphone to ask your question, please say your name, say your affiliation, and then after that, please keep comments to a minimum and just ask the question. Keep the questions short and crisp. And I will probably take a couple of questions when the questions start coming and be able to group them into different themes for discussion today. Okay, so maybe moving a little bit from people into strategy. So Chairman, I think in the first lecture, you talked about the growth of electronics, you talked about the hard disk drives, you talked about Jurong Island and chemicals. So I wanted to ask, how did you decide to do biomedical sciences as a specific area? I mean, what was it about it that made you decide?
Given my experience at Jurong Island, where I put all the petrochemical companies together, so I asked Lim Neo Chen, what I want to do is to find a piece of land in Tuas, reclaimed land, which eventually became 360, 370 hectares, all totally reclaimed, put all the farmer companies together. So you go to Tuas Farmer, all the Roche, Novartis, everybody is there, Pfizer. So all together. In a sense, it's good because they can also share their experience. And same time, they can also, the talent is out there. So in Singapore, what I've done, normally in a pharma industry, is one company here, one company there. It's the only place in Singapore where all the pharma companies are in one location, Tuas Pharma. And that's where the production of all the drugs are done. We produce 40+% of the world proprietary drugs, and most of them are cancer drugs, all in one location. So it's almost a replica of Jurong. Jurong Island is 3,200 hectares, but in the case of Tuas, it's about 380, 390 hectares of land, and they're all down there. For medical devices, we scatter them because they are all in JTC industrial place, but for the pharma area, it's all in one location. In that sense, JTC provided the custom support what they need. Because in drug manufacturing, there's also waste products you take care. You also need to ensure supply of electricity. You need to also have a support for example, if the FDA come in to check, they're all down there. So Singapore is unique in the sense our pharma industry is all one location, housed together deliberately. There's no other country that has done that.
And did you choose it because you think that it will never grow old? Like people will always need medicines or pharmaceuticals? Like why not another industry?
Well, people will not grow, people will live longer.
Yeah.
So hopefully they will need all the life protection, preservation. Right now, the greatest hobby I usually read in newspaper and the magazines are longevity. So there are a lot of Chris Sinclair and Leon Guarantee all working on this setting idea of immortality. It's a wishful thinking, but that's it. People may live longer, but the longer you live, the probability of needing healthcare is exponential. If you're an engineer, you know what's the utility curve. When a product is made, the first 2 years is not reliable. Then after that, it will stabilize. And the last phase, the product will break down. So human beings are the same. When you have less than 2 years old babies have a problem. The first 2 years, after that, it will stabilize. And by the time they are 60, 70, their failure rate goes up. So we are almost a human utility. As engineers, look at point, we are all different failure rates. But difficulty is that the cost of medical medicine, for example, now in America, big scandal, healthcare insurance, drug costly. So it's a big challenge. So in America now, healthcare cost is about 19% of the GDP. Singapore healthcare cost is about maybe 4%. But it will eventually go up because as people live longer, utility failure rate of human beings will happen. Then how do you keep the best? Ideally, the best is to find a way to treat early as possible or scan and detect as early as possible. Then you can then reduce the cost of the ultimate cost at the end of the longer, when they are over 60, 70, 80. This is where the problem comes about. So healthcare costs will never go down. In fact, one of the few industries that will be never, the demand for doctors and nurses will be the best is still healthcare. Every other industry can AI, can do what you can automate. You can automate the doctor. You can get the doctor to use a robotic assist, but healthcare is a human-intensive industry. So in that sense, if you're a doctor and you're a young person, there's the biggest challenge is to find a job as almost maybe a doctor with AI experience. So the key is healthcare is an ever-growing industry.
And maybe using your analogy, we have to do preventative maintenance of our equipment and machinery. Okay, so I'm starting to get some questions online, so I can see them. I think they've been... So maybe I'll ask one question from Desmond. So the question from Desmond is, of all the wins and lessons learned, would you redo any particular program that you've... Of all the wins, as well as maybe some of the not so successful efforts, would you redo any program that you had started, or would you have done any program a bit differently? All
the industry I've done?
Yes, all the industries that you've done.
Well, no industry lasts forever except healthcare. When we first started, when I brought the disk drive to Singapore, the disk drive in 1986 was 5 megabit, big chunk, 5.25 inch. Today they are in solid state, so that's changed. And when we had Motorola producing cellular phones here, today there's no more Motorola, now it's Apple. So especially in gadgets, devices change. So I remember we went to iOmega, all the data storage all gone. The only data storage still alive today is data storage, Western Digital and Seagate, but they are now basically for AI data centers. Most of the data centers are still using Western Digital and Seagate disk drive, and they are very big disk drive. But the rest today, your phone, the drives are all solid state. So industry alone, especially in hardware-wise, will change. Even in a hospital, hardware devices will change. But the biggest challenge is drug development, and that will something much more challenging you have to keep on innovating new drugs. No cancer drug treats a patient. When a patient with any particular cancer, after phase 1, phase 2, phase 3, the drug works. But then eventually the patient will have a relapse, bound to have relapse. Then the drug is no longer effective. So in the best American university like Dana-Farber, they will look for new drugs constantly because the cancer is something you can't totally remove. I remember my good friend John Dick in Toronto and Irv Weissman believed that cancer is not just to eradicate, but the cancer will remain as a stem cell. So there's a theory belief that the cancer will never be totally eliminated. It will always come back. The key is how to prevent the relapse and how to find new drugs. Because every drug eventually will fail. Because the body is smart enough, the cancer smart to tolerate. So the biggest challenge for drug development is there's no final drug that cures. So for example, I was looking at a paper on multiple myeloma. They are now testing a lot of new drugs because most of the drugs after the 4 or 5 years will fail. No longer effective. So drug development is a never-ending game. So that is the biggest challenge. Yeah.
That is the biggest challenge. But very much a worthwhile effort because it's, I guess in this case, Singapore is playing the long game because this is a capability that's not easy to build. And as we spent, I guess, the last 40 years building IMCB, and since BioPlus started about 20 plus years, it's really starting to show fruits in terms of both the intellectual property as well as the people that have been brought through. So with regard to, there's a question.
Yes, please, Lisa. Can you hear me? Right. Thank you so much, Philip Yeo. Like you, I am not a politically astute person, so I'm sure you appreciate my questions. Can you hear me?
Yes, we can hear you.
Because he's doing this. Can you hear
him?
It's okay, go ahead.
Yeah. So what is the population size of the $600 million petty cash for Skills Future that had to be distributed to? And comparatively, what is the beneficiary size for the $1 billion in scholarships? Of the Singaporeans that you fleshed out, how many are born and bred here? Because I've had to convince this district councillor from the grassroots that I'm not from Brazil. Yeah, I don't know why he assumed I'm from Brazil. I'm born and bred here. Yeah. So a good tree bears good fruit, regardless of the number that you've robbed, stolen from MIT and all the other places, research centers. MIT continues to be the world's best, continually generating the best of the very best, including Nobel laureates. Where are your fruits? Where are the Nobel laureates in Singapore? Kindly share the generated value of the multi-billion-dollar buildings and the multi-billion-dollar spent. Where are the Singaporeans born and bred here? Thank you.
Well, put it this way. When I launched a scholarship in 2001, the average PhD student is 4 years bachelor, 5 years PhD, 3 years postdoc. The first batch of scholars came back in 2012, 2013. Today, 2025. Nations like Switzerland, Scandinavia, Switzerland, years of work. Biomedical science research is not something you produce overnight. Many of our scientists now young, they are still young people. They are all in the early 30s, mid-30s. You are not expecting to produce a product. You produce intellectual knowledge. So if you want to look at from an intellectual point of view, we have invested in all these people, and then we are here. When will they produce result? When was the Nobel Prize? America started Nobel so long ago. We are a nation of technicians trying to be a nation of scientists. So you must have patience to see the outcome. If you're not patient, forget about it. Got it?
Definitely true. Thank you, Chairman. Actually, we've been using the term "we were a nation of technicians," and you remain a nation of technicians unless you build IMCB, invest in capabilities, then you might become a nation of scientists. So now that we are becoming a nation of scientists, the next step is how do we become a nation of scientists and entrepreneurs? So, Chairman, I guess I have in your first lecture, you talk about can you change the person or do you change the people? So maybe I ask a more controversial question about whether, do you think scientists can be trained to be entrepreneurs? Or do you think that that's a completely different skill set that requires a different breed of people?
Well, if you go to biotech startups, most of biotech startups are scientists. They are good in their knowledge, but how they become commercially oriented. So the key for them is to find a management skill. So most of biotech companies were started by young scientists. They look for experienced managers to be CEO, who have run companies before. The challenge is how do you convert a scientist to become an entrepreneur? So all the startups' biggest challenge is to find the managerial hand-holding to convert. Today, there are many biotech companies, the CEO are scientists, but they are no longer young people. They are gone through the years. They start companies, and many of the companies start fail. They grow up. So if you look at all the biotech companies in America, they are all very senior people. But they go through this change from the lab into the real world, which is finding drugs, how to manage the development of the drug, how to manage the clinical trial, how to manage the production, how to manage the distribution and sales. And that is the biggest challenge. You look at the COVID vaccine between Pfizer and BioNTech. The husband and wife, they are both scientists. They work on a vaccine, RNA vaccine. But Pfizer is the one who is able to scale up, produce, and sell. Pfizer has 17,000 salespersons to sell drugs. For BioNTech in Germany, husband and wife are scientists. They have intellectual knowledge, but they can't scale up. So they combine between the intellectual knowledge and the commercial vehicle of Pfizer. Moderna is another example. Moderna, they have all the support of the scientists there, but Moderna outsourced the production to Lonza. Moderna doesn't have a factory until later. So you have to find a match between the startups and the big pharma. I need that nexus because it's an industry where big pharma can bear the cost of clinical trial. What's clinical trial? I produce a drug to give to patients, phase 1, phase 2, phase 3, I say phase 2 and 3. And I need to test multiple populations, different states, different cities, and it takes about 7 years. And if the drug is approved by FDA, okay, if a drug fails, it's a write-off. The cost of development of a drug is $1.5 billion. $1.5 billion per drug. In fact, the cost has gone up possibly to $2 billion. Many of the drugs that succeed, you see them, but many of the drugs fail, is a write-off. So big pharma depends on high returns to fund. The burden of big pharma is that clinical trials is very expensive because you produce a drug to give to patient, it tests. We are all not standard human beings, we are all mutants. No drug works perfectly the same as any individual. So therefore, there's bound to failures, reactions, and then the drug is recalled. And that's the end of it. So drug development is very complex because there's no such thing as a drug that treats everybody as equal. And that is the biggest challenge because we are all, in a sense, variants. So only big pharma can do it. Even now in Japan, there are only 2 big pharma companies in Japan, Takeda and Astellas, big pharma companies. No, not a small one. In Switzerland, there's Roche and Novartis, right? In Sweden, there's AstraZeneca. In US, it's basically UK, GSK. Then you got Bristol Myers, Pfizer. That's it. These are big nations and they only can hold a few. But the key challenge of all these nations, they have years of science and knowledge. Science and knowledge takes time to build. It's not something you put like putting a durian tree, 7 years you get a result. Science is not a durian tree.
So,
Sir,
please introduce yourself.
Yeah, sir, thank you for your wisdom and your presentation. My name is W2 from Singapore in Johor. Now, has Singapore evolved into a nation of property speculators instead of technicians? May we have your wisdom and advice as to how we can motivate the young in our society to be more curious about science, about technology, and more importantly, about being naughty. You see, what I especially admire about you is you have that uncanny ability to be naughty, break rules, and you get away with it. So I think this is one of the most endearing qualities of the human civilization. Most innovators are actually extremely naughty people.
Thank you for your question.
One last question, please. What's your take about Elon Musk's method of teaching his children? Perhaps we could pick up some tips and do it here in Singapore. Our Ministry of Education seems extremely obsolete, in my humble opinion. Thank you.
Can you tell us what Elon Musk, what's his way of teaching his children? I'm not so familiar. I don't know who Chairman is.
Well, hands-on. Hands-on, solve problems at a very young stage.
Elon Musk is an engineer.
So are you.
An engineer to handle, make things.
Yeah, let's...
An engineer is not a philosopher, or people that argue for the fun of arguing.
No, let's motivate more to be engineers. Simple.
Thank you for
And
your
start
question.
them young. Thank you.
Thank you.
Yeah.
Maybe we take your question, and after that, we'll group them together and answer.
Thank you so much. I'm just wondering, what would you
Please
tell...
introduce yourself and your
Sorry,
affiliation.
my name is Patrick, just an individual. I'm just wondering, what would you tell President Trump and Elon Musk when you meet them? Thank you.
So Chairman, maybe the first question about how would you inspire the next generation to be interested in science, engineering, and be curious? And also maybe, maybe to the not so young, like my generation, how can we be more curious and more can-do like you are, Chairman, to be able to have that spirit?
No, Singapore, thanks to our Ministry of Education, I think our foundation of science knowledge in our schools are very good. The key is how to keep their passion and interest in science. Because it's an area where if you really want to become a scientist, it's a very long journey. You do your A-level, you do your bachelor degree, you do a PhD, you do a postdoc. By which time you are only financially independent around 32, 33. So it's almost like a monkhood. If you want to be a simple, get a degree, go to law, go to business, make money. But intellectually is a different game. So scientists pursue their knowledge because they are interested in knowledge. Financially, they are a lousy deal. They are not highly paid. Unless they achieve, like Bob Langer come up with some treatments and devices, or Irving Weisman make $190 million from a C-47. So science is a passion. So if a society values people who have passion and their knowledge, not just financially, that society is a very mature society. If the society is purely on outcome quickly, get results, buy property, build a GCB, do trading, go to banking. So it's not the same. So for society to value knowledge, that will create the foundation for the younger people. Then the older people knowledge is something that you must take an interest to read. If you don't read, then I don't see how we can find knowledge. Obviously today, you don't have to buy a hard copy, you can buy it online. But the key, you must going to read, because Sidney Brennan used to say, he likes to read useless facts. And to me, it's useless today, but the knowledge, so a lot of time I read also useless facts because I pursue a lot of interest, but my ability to put them together for some future industry is there. So unless you are willing to read and read widely and interested to be curious, you have no knowledge. You are very good at asking questions, that's all. So you need people to be curious to find, is there something that can be done? And that's how we create a society. Smart people come from that way. Yesterday, Fei Li was talking at the garden by Bakuna 10. So I asked one friend to send me all the notes. I circulated to all of you. So you need to have that type of curiosity. Fei is about 48 years old. She went to America aged very young. Mother ran a laundry shop. Father did some repair work. And then she went into Princeton for a bachelor degree. She went to Stanford for a PhD, and today is one of the top in AI. 48 years old and doing very well. So a society that values talent. A society is not just what's the outcome of cash or instant result. Yeah.
And I remember reading Chairman's story about when he was young and how he chose to be a librarian instead of a prefect. And the library had air conditioning and you would be there reading books, I guess, of many different types. So maybe we should go to the libraries of the primary school to start to capture and kidnap and groom some of these curious individuals. I see Conrad standing there, so maybe Conrad.
Well, thank you, Lisa.
Introduce yourself, please. Yeah.
Sorry, Konrad Paszkiewicz from Hummingbird Bioscience. So, thank you for having us, Mr. Chairman, and for talking to us. My question is around your ability to sort of capture guppies of various sorts in various industries and bring them to Singapore. I feel as though there's one piece that might be missing in the quest to have very large-scale drug development in Singapore. And I worry that we are not capturing sufficient value from the drugs that are made in Singapore. And that's primarily, I feel, because we're in a position where we have to sell out to foreign VC firms at an early stage in order to get the drugs to a point where they are attractive to big pharma companies. And I was wondering if you had any ideas or thoughts as to how your approach might be useful to bring all of the capital that is in Singapore to encourage drug development and to help support some of that drug development, because the capital that is in Singapore is quite risk averse. So just wanted your thoughts on that. Thank you.
So I guess it takes all kinds in an ecosystem. You need the scientists, you need the who can can start companies, be co-founders. You need the entrepreneurs who could potentially run the companies, and then you need the capital partners to really come alongside. And Chairman, maybe you can share a little bit about EDBI, your thoughts about, actually that was a real pioneer. During that time, it was one of the largest, world largest, maybe ahead of its time. I
set up EDBI in 1987, after my second EDB. And I gave EDBI $40 million. This is 1987 money. And every investment they put, it might not exceed $1 million, but every investment they put right down to 10%. Because I expect most of them will fail. If you expect all of them to win, you cannot sleep. You possibly worry to death. So my idea is $40 million, at worst I write down to $4 million, 10%. But many of them succeeded. But the key was not to make money, but to bring the company to Singapore. So in that sense, what we did was then we went to Big Pharma. Look, these are the projects you're interested. Can we help you? So we couldn't succeed with a startup because startups, the biggest challenge is many startups die. But the key in a startup, when you die, the startup fail, the people must learn how to do the next startup. They will not. So those who fail, if you don't fail, you never learn. So failure is a means in a startup, whether in AI, IT, or medical science, worse. Medical sciences, many a drug fail not because you are wrong, but because your phase 1, phase 2 data doesn't produce the results. Because can this drug or treatment prolong the life of the patient X% versus other drugs? So the challenge is to find a solution. But many of these startups fail. And I noticed companies I have seen in Singapore that fail. But the people who fail, hopefully they learn. So the next product, the next project they are more experienced. So failure is a means to learn. So in the same case for our biotech company, we must expect failure. Failure is a fact of life. If you don't fail, they best do nothing, which is the most perfect way. Grant happiness, you sit down, do nothing, don't invest in people, don't invest in the startups, don't invest in anything. That would be the best way for any society. But society wants to succeed, must keep on trying and trying. In event of 10, 20, 1 or 2 will succeed. And that will take off. Look at AI. The Chinese have poured all the effort into AI. There's only one DeepSeek. Now Alibaba is coming out. Now Baidu is coming out. Will they produce results? So AI today in China, DeepSeek, is it financially viable? We are still doing it. Now they apply AI to industries, to manufacturing, or to even financial management. So all of things, so the society must be interested to experiment. If society doesn't want to experiment, doesn't want to invest, might as well become a monastery.
Chairman, that's definitely music to our ears, that we need failure to show that we're at the cutting edge of innovation, right? If you never fail, then you are really not innovating. And the capital that accompanies it needs to be less risk averse.
We must treat failure as a fact of life. how to fail and how not to repeat the same mistakes. By which time you are wiser, you are smarter, you know how to avoid that. But if you don't try, you never learn. If you don't fail, you never learn. Yeah.
All right, I see a young gentleman. Please introduce yourself.
Hi, I'm Marcus. I'm an economics undergrad, and Mr. Yeo, I want to thank you for your insights on Singapore's biotech sector. As for my question, I wanted to ask about the future trajectory of Singapore's biopolis. As you noted, that due to Singapore's size and structural constraints, it may limit its potential in like securing later stage R&D and translational work in production. So given these limitations, how might Singapore more effectively carve out the previously mentioned niche in R&D, early discovery side R&D, especially considered how early stage biotech research is often very capital intensive and high risk in terms of profitability? And building on the previous lecture where you touched on the necessity of scaling up, right? Do you foresee that any scaling challenges if Singapore's biotech sector has to shift towards more early stage R&D rather than downstream production kind of stuff? Thank you.
Well, that's quite a few questions in there. I think maybe the first is with regard to maybe markets. I think maybe one way into which to distill that is that actually Singapore, do you think that our small market for the biotech sector is an impediment to us being able to do biotech research?
Well, you look at Switzerland, which is about 8 million people. Sweden has about maybe 5-6 million people. But it has not stopped them from building up the drug industry. It took a long time. Right? So it doesn't mean a small country cannot do it. The key challenge is that we are a latecomer. We are a nation of technicians, in fact, a nation of traders. Singapore started as a trading society. There are no scientists here. So science only started from 1991. In fact, I took over in 2001. So to me, science in Singapore is only 25 years. So if anybody complain, please check other nations. You go to Switzerland and Sweden, they are all, I go to Karolinska, and all the people there have been working there for a long time. You go to Switzerland, you go to Roche Novartis. So it's not beyond the possibility of a small nation. The key is you have to focus what drug development. And the key, when I visit Novartis and Roche, 50% of scientists are drawn from Germany, France, Italy. So they have a talent pool. The advantage, they have the market. For us, the biggest challenge is that we have no market. Not true. We look at ASEAN as 670 million people. We have multiracial. So can we look at where our precision medicine can find data that can apply to the Malay community, the Indian community, the Chinese community? For example, the Chinese, the Cantonese have always NPC, nasopharyngeal cancer. So every ethnic has a range. So can we use this information? That's why I first proposed idea to have this precision medicine in 2007. Now we have come to 450,000. We have 450,000 human genome. Can we break up into different racial groups that we can apply for treatment? Our neighborhood is a potential. Now, where to succeed? Now, the problem for us, we already can have a company that's big enough to produce it for clinical trial in the region. And that is the biggest challenge for us. The only way is to see whether we can collaborate with our neighbors. Because our neighbors, 600 million people. In Singapore now, is well known for healthcare. But healthcare cost is high. But the most difficult cases, they come here. Cheaper, they go to Penang. They can go to Thailand, but we are attractive. So can we develop treatments or protocols that can benefit our neighbor? Something worth. So the hope is that natural precision medicine give us data that we have 3-4 different racial groups. There are unique diseases peculiar to them. Maybe we can apply to the multinational. Look, these are the drugs. These are data we have. Can you use it to develop the market for us? So it's something worth trying. We will succeed. Well, we are supposed to. This year is the last phase, right, of the 450,000 data we're collecting. Hopefully, we can use it for us to look for treatments.
Yes, yeah. So we are about at the end of phase 2, and hopefully going to start phase 3 for the 450,000. And actually, there's been an intention to actually diversify across the 3 ethnic groups to make sure that we enrich for some of the.
In fact, if we look at the 450,000, we should look at not just the young, but also the aged. So if we collect all the genome data, which is basically your blood samples, your tissue samples, what have you, and then collect it and look for what we have. In Singapore, we have a high incidence of lung cancer of people who don't smoke. Right? They have high incidence of NPC. So there are some unique and racial group. There are high cases of cardiovascular on certain ethnic group. Partly also the diet. So I'm very curious, or John was very curious, how do we analyze all these data? So if I have a medical sciences, there are treatments, there are cases of disease very unique to each different group. If you look at the reality is that we are multi-racial, but there are also good potential data that we can use. If we can collaborate with our neighbors, Indonesia, even Vietnam, there are a lot of things we can share with them. That's why I'm quite keen to attract talent from there to come here, because then we also bring a bridge to those nations. We attract Indonesian doctor scientists to come and work here, or just on WhatsApp with Stella Christie is an Indonesian lady. She came to Singapore to do her primary and secondary school at CHIJ Toa Payoh. She went to America, did a bachelor in Harvard, then a PhD in Northwestern. She returned back to Indonesia to do the Deputy Minister for Higher Education. Indonesian Chinese, smart, so just WhatsApp with me. So I said, look, if we can collaborate between the medical people in Indonesia and Singapore, we have 270 million people. So I told her, when you do come and visit, talk to our Ministry of Health, talk to our universities, and see how we can collaborate. The other potential is Vietnam. Vietnam is homogeneous. Indonesia is homogeneous, except for minority of Chinese. So you have big, large Malay population or Vietnamese population. Even in Thailand they have. So technically, if I were a young doctor scientist, there's a room for attention to look at ASEAN scientific collaboration and medical experience, or better, you can do clinical trial in those countries. Traditionally, clinical trial is done in developed markets. So if we can do clinical trial, for example, in our neighboring countries, it can be a great help to drug developers.
Yes, definitely. So maybe we'll have two questions from the gentleman on the left, maybe from the top, then to the bottom. Sure. Please introduce yourself.
Yeah. Hello, sir. Thank you for your remarks earlier. I'm Ethan. I'm an entrepreneur that I run an AI agent startup that serves the construction industry. So you spoke about AI earlier. Obviously, you read a lot about that, right? Media has been spreading a lot of narrative around how AI is going to take over jobs. Obviously, it resonates with a lot of large groups of society. So what advice would you give to people in the wider group of society, right? Like, how can we progress as a society with the technology coming, right? Like it or not, it's here, it's not going away. So what advice would you give and what's your take around it? Thank you.
Yeah, thank you. And maybe the next question.
Thank you, Mr. Yeo, for your sharing. My name is Lee Hong. I'm from NUS High School of Math and Science. So my question is with regards to the very strong publish or perish culture in science research. So for example, the Dana-Farber Cancer Institute that you mentioned earlier, they were recently in a scandal where there was a large amount of data falsification in some papers. And my question is, how is Singapore trying to mitigate that kind of pressure in order to encourage more young scientists? Thank you.
Publish or perish, as well as AI?
Well, publish or perish is a fundamental problem in research universities. But really, strictly speaking, there are universities like MIT, Stanford look at more in collaboration with industry. So if you publish, at least what you publish that can be used in industry, especially in drug development, like Albert Weissman now is working on another drug. So yeah, it's published, but you want to use it to take it further to a potential treatment. So publishing for publishing just to get a citation, that's only for academic pride. But what we want in medical science is you publish a paper, you attract interest, and you look for a potential to create a company or product. It's a different mentality. So publish and bring a product to the market.
I think in some instances in companies is you publish and you perish, because sometimes you don't want to publish, right? Because you want to keep certain intellectual property in-house. And sometimes maybe when something fails and you don't get to publish, it's actually a good thing because you have things that fail fast rather than running down something that actually doesn't actually translate in the end. So actually, I think it's a different mindset when you do research and innovation towards a view for translation and impact.
The danger for publish and publish is the reward statement in university. If a university rewards its academic staff by just publishing, or then get promoted. But what we want to encourage them to publish and bring it out to a product, to the market. So we should not encourage just to publish. The key is it useful to bring it to the market? And then we will work with industry, collaborate with pharma companies, especially in drug development. In drug development, you don't just publish for publishing's sake. Maybe in other disciplines, but in most drug development, actually for academic labs. And then the professors spin out companies. Now, whether all the companies succeed, most will fail. But then they learn from there. So you look at carefully at most of the scientists who bring out products. People like Carico, the lady from UPenn, she published a long time. She never got promoted. But eventually the university realized, belatedly, the idea of RNA, with the LPS around the RNA, or 4 layers RNA, you can deliver RNA into the body. And she's now a billionaire, a millionaire, I don't know. For years, she could not get promoted by UPenn because she was publishing not something that they want to see for citation. But she played a important, and her colleague, Drew Weissman, who got a Nobel Prize, helped her, supported her. If not for Drew Weissman supporting Carico, there would be no Moderna today. No RNA vaccine. The challenge was that Drew helped her, that RNA is not the problem. The problem is RNA, when it goes to the body, get destroyed. So you need to develop an envelope. And what developed was LPS. 4 layers of envelope around the RNA. It gets to the body, it breaks down, activates the cells, your own immune system work. So Carico is no longer young, but took many years. For years, she was not promoted. But Drew Weissman supported her, and Drew Weissman got a Nobel Prize last year for RNA. So there's nothing wrong with publishing. The key is, besides publishing, what else can you get? If you publish to get a citation to put on your shelf, that's not of great value. In medical science, you won't publish for publishing's sake. You're trying to look for a drug or treatment. It's a different mentality.
Yeah, thank you, Chairman. And then how about the question about, I mean, you have 3 beautiful grandchildren, and I have young children, and so I think about how do they survive in this AI world? Do you have any advice for us, even
how do you survive?
In this AI world? I mean, in the biomedical space, you had said about healthcare being a human.
In AI world, I don't see AI as a threat, but how do you use it? So if you're a scientist, if I can use AI to screen drugs, possible proteins for treatment, I don't see anything wrong with that. For a young child, one of the biggest challenges now in the US schools, the kids are cheating with AI now. So, but there are software available. The key is that if the AI is there, how do you cultivate a culture that they go beyond just read an article that all the kids in the US schools are now cheating. How to solve problem? Maybe Ben can give advice how to solve cheating by kids. Unless the teacher is smart enough to know, look, so maybe they write essays, but even then you can go to AI and create essays. So it's a big challenge for the teachers of today, because the kids have all this advantage. Write essay about, let's say, drug development. The AI will generate for you. So the key is how do you find a way to make sure the kids are not cheating. I have no answer for that.
So, Chairman, I will now maybe take a look at some of the questions here online. So maybe a question from Henry Huang online. So thank you, Henry, for your question. He says, thank you, Chairman, for your insightful sharing. And he says that innovation needs to break the rules, and our kiasu culture does not fit this well. So how do we facilitate the next wave of nation translation from a country of science to a country of innovation? I guess, with regard to asking for permission or saying sorry, Chairman, how do you think Singapore can transition to that?
No, the key is in the education system. You must allow your students to experiment, to make mistakes. You should not have a system whereby there's only one answer. So it's a different, so the key challenge will start from schooling. So I remember when Tama was the Minister of Education, I used to tell him, go and visit this school in California, run by a few people whom I know. There are only 10 students in a class, and there are 2 teachers, and 2 teachers are all masters and PhDs. Except that school was only from grade 1 to grade 9. After that, they go to high school. So Taman was very interested in visiting all the small schools, and the key is that the education system is the key factor. So how you stimulate interest in a child, how you stimulate curiosity, how you reward experimentation, how you expect, there's no perfect answer. But if the teacher says, look, this is the only correct answer, then you have a problem. So the key is that you have to nurture from young. And a lot of experiments on it. Even Dr. Goh came up with a gifted program, how to stimulate interest. But the challenge is ultimately execution. How do you find the teachers who can then stimulate, encourage the kids? So I'm always interested in small groups, small classes, where the kids are, I remember I visited one school in California. There were 10 kids, and there were 2 teachers standing aside, and they were developing the master plan for the city. They were 9-year-old kids. And they used all kinds of paper, tissues, created a city, almost like city planning, URA type. They were 9 years old. The 2 teachers took aside, gave it to them. They make a mess of the whole room. They push all the tables and chairs aside. They're sitting on the floor with newspapers and cardboard, create a future city. That means the key is not the kids. The key is the 2 teachers encouraging the kids. So you are looking for that teachers that were encouraging, willing to let the kids do their own thing. And those kids 9-year-old, I was very impressed. They will have a master plan for a city. It's almost like SimCity. I used to play SimCity. My son used to play, I watch him. So here was kids doing SimCity on the floor in the classroom. So the key is your education system. Now, how to give, every child is not an average child. Every child is different. So you need to have a system where the teachers allow the kids to experiment, to make mistakes. And that's the only way is to stimulate interest. I can't see a system where the kids, a big class of 30, they're all regimented, take the same exam. You have a challenge. So many societies have tried. In Finland, I remember Taiwan, visit Taiwan. The teachers stay with the school kid from primary 1 to secondary school. Same teacher. They don't change teachers at all. Not that every year, different class, different teachers. The same teachers for the kids from grade 1 to 7, because their system different. So the teachers know all the kids very well. So that requires teacher intensive. So these 2 teachers, the teachers in that class, take care of kids from grade 1 to 6 or 7. Called primary school. After that, they are different. It means you have to dedicate it to you. Don't post the teacher around. So it means that teacher must be a multi-purpose teacher, not just a subject, but ability to manage the student. And Finland done that. Now, they are a small society. I think Finland's population, my friend in Finland says they're only about 4-5 million people. But they're homogeneous. So I guess, and education is free. Education in Finland is free. University is free. Same in Sweden. You can do a PhD in Sweden. In Sweden, if you do a PhD at Karolinska, it's free. Because the state taxes are high. So tax goes to fund childcare. The tax goes to fund free education, everything. But that's a society. So you want to increase the tax to pay for these social costs. So American model is nothing is for free, you pay. No money, your problem. Different society. So I look at Scandinavian countries, Finland, Sweden, Switzerland. Switzerland is very interesting. In Switzerland, every canton, there are about 26 cantons, run their own school system. And it's all funded by them. Their taxes are so high. So, but the taxes go to healthcare, to education and childcare. In Sweden, childcare is free. So you go to work, you bring your child, leave it at the childcare center. The childcare center is funded by the state, right? Then you focus on time. 6 o'clock, 7 o'clock, you take your child home. So, and those childcare are professionals. They are not just secondary school teachers or they are professionals. But that requires, so Sweden has a tax of about 60%. Right? So it's how you do your social distribution of costs. Yeah. High taxes, but they are social benefits. In that sense, so if we want to be American style, although the taxes are not cheap, you leave it to every individual. So the rich can afford, the poor can afford. In Sweden, they all go through it. Yeah. So it's an interesting system. So I always look at small countries. Don't compare ourselves. I look at Switzerland, Sweden, Finland. And these are small cities, small nations that we can copy. Yeah.
So instead of stratified medicine, Chairman, stratified education, but really requires a lot of effort. I mean, marking papers, I realize there's a lot of keyword marking in science papers in primary schools here. So the ability to actually distill the concept, right, and understand what the child is thinking and to inculcate the love for science is not easy. So I see a young lady up there. Would you introduce yourself, please? And I think this will probably be our final question because we have 4 more minutes left.
Hello, so my name is Mantika and I'm from Nanyang Poly. Just some background context that I'm a student studying product and interior design, so basically I'm doing Sims but in real life. And I'm just interested because there's a lot of mention about the entrepreneurial spirit that we have to inculcate to the youth, right? But I realize from my peers around me that they're not very experimental in nature, especially when you note in healthcare where scientists, they would not want to venture to like the entrepreneurial spirit because they want to stay in their safe space. So how do we as a society, a Singaporean society, really push our youth to go from a safe space to a more like risk-adverse job like entrepreneurs? Thank you.
At what level? At what level are you talking about? School level?
I'm talking about youths because I'm more interested in finding out like how do we convince our youth, like my peers, to choose a job that requires them to like have this risk of failure to have their startup, compared to a safe job like going into AI and tech?
Yeah. Is that safe? Yeah, AI.
Yeah. Thank you.
Put it this way. Today the kids are lucky because the parents give them a lot of freedom to do what they want. So the only time I hear is when a young Singaporean finishes degree at NTU, they're going on a gap year. Well, it sounds like a holiday to me. My generation have no gap year, we work. So the key is that maybe our kids are lucky, they are relaxed. But if you have a society, you must be curious to do something. Can a gap year be something working in a project rather than just a gap year or holiday? In fact, I'm surprised the kids are going on holiday, take it easy. So it very much depends on the value, because now most families are 1 or 2 kids. And one of the problems is that parents spoil them. You finish your A-level, take a gap year, or finish a degree gap year. If I would be a young person, I'd be curious to get attached to a company, go and learn. Maybe get, for example, in PYI, I fund young people to attach to companies, to attach to different, so they get exposure. The key is you must have curious people. Then how can society support them? How can the parents support them? So whenever I hear for gap year, my hair stand up.
So actually, maybe that's a good mention of a PYI that Chairman mentioned is the Philip Yeo initiative. So I encourage young students, young fellows to actually look at the program, opportunities to really make an impact. We're looking for entrepreneurial young people who are interested to make an impact in our world through attachments with various non-profits as well as companies. Yeah. So actually with that, I think we have leaves me to just thank Chairman for his wonderful lecture and his and the great discussion that we had today. So thank you for coming.
Thank you.
Thank you, Mr. Yeo and Dr. Wee. We've come to the end of today's lecture. We would like to hear your views on the event. Please click our link on the Facebook feed or scan the QR code on the screen to submit your feedback. Mr. Philip Yeo's third and final lecture titled Singapore Enterprises Grow, Glow, Globalize will take place on 8 May. Details will be on our website and IPS Facebook page. We hope to see you then. Thank you.